our surgery people on top this ability inside disability podcast. And welcome to another Saturday of this amazing podcast when we get where Modukwe Afizogun Foundation they carry come give us. And today another day, and we don't bring another better topic, we don't bring another better yarn. Come give all of us today, and I sure say I go learn where we. My name na Ini Sam, aka Oga Ini, and that today na me go introduce the host of the podcast. Na me go introduce Mrs. Modukwe. So I beg, if something there you have me keep a big clap to say. Welcoming on stage.
Nari on stage.
Mrs. Modukwe Afizogun, the CEO founder of Modukwe Afizogun Foundation, and the amazing host of the Ability Inside Disability podcast. Make I do the ways you follow yourself. Make I feel, make you greet our
A guy never learn work well.
Yeah. I never collect certificate.
Never collect certificate. I need to do supervision. My people, now good afternoon. I beg one no verse. This MTN they show us small shaking for here. Now they try they fix this network problem. Now welcome this afternoon. No. Now do well so now join us today. A guy need to introduce me well. As now know, now maybe Mrs. Modukwe Afizogun, CEO founder of Modukwe Afizogun Foundation, where they bring this Ability Inside Disability podcast every Saturday. They come. Today, our topic today is a very, very interesting topic, a very, very important topic, because now what it affect everybody and anybody, and to support us for this topic. In fact, now I ain't go teach us waiting. This matter be and how it they affect members of our community and their family, and every other person will still benefit from now Dr. Dana. Dr. Dana, I will give Dr. Dana a chance. Make it a greet to now, make it a tell you now who Dr. Dana be. Welcome, Doctor.
My people. Now good morning. Good I greet to know very well. As she said, my name is Dr. Danat. I be gynecologist. That means saying now only women I dey see. So today they can't pay with that. Now welcome.
Oh my goodness. Dr. Danat, I don't know who I dey see. You know what's in man?
That is
okay, my people, as now know today's topic now diabetes. Now diabetes and how diabetes, the risk of diabetes for the life, for the body of people we get learning and intellectual disabilities and their family members. So, Dr. Dana, what is this diabetes?
As you now know, for English they say a sugar problem. So that's diabetes. So diabetes means say somebody sugar they high.
Okay.
And for that sugar to they high, something they happen. If it be say that person, there's one thing for person body what they call pancreas. That pancreas now they produce one thing what they call insulin. Now that insulin they help us. So if you chop plenty sugar, this insulin go just pack them. Go put them for one side, either for liver or for other part of your body, so that you know go day plenty. So if they think one day too much for your blood, that pancreas go make it day normal. So people will get diabetes. Now either the sugar can't day too much for them, or that pancreas can't weak. You know if they gather those sugar way one day too much for your body, go put for one side. So the sugar go just day high. You go see the person they piss 10 times, 100 times a day. Person they drink water, is still they thirsty. Person they eat, is still they hungry. So that is diabetes for you. So it is actually when you have very, very, very high sugar. And that sugar way they high, they do a lot of things. If it affect your eye, if it affect your brain, if it affect every part of your body. For pregnancy itself, it affect children. We'll go here later how this diabetes they do for body.
Doctor. Now this show, now your show, now you can talk about it. Now learn, make on learn. Yes. Because you know this diabetes. Now two type now.
Yes.
As I know. Type 1 day, type 2 day. So which means say even thank God, our doctor just now say now only women are in the truth, which means we know children matter join.
Join. Women and children.
They work together.
Anything we join woman.
And you must say no papa matter way concern the woman and the children. So you know say now.
That one day.
I don't drag your leg come out.
Okay.
So now you're not going to run from all of them. Because all of them connect with each other.
Yes.
So as this diabetes matter where they talk, they come, Dr. Abeg, help us differentiate between the type 1 and the type 2.
Good. The type 1 diabetes, now the diabetes where most of the times they occur for small children or young adults. That one, maybe the person they get born with that insulin problem.
Okay.
Have an issue. So no be saying inherit them from his father, or they just have for so on no reason the insulin no they function well.
Okay.
So that one they occur mostly for young people. So that one are type 1 diabetes. And you will see people less than 30 years, you will see them get diabetes. But the type 2 they occur for any age. But that one is mostly related to gene. You acquire it for sometimes from your lifestyle.
Your lifestyle.
Person will get weight, if you control that weight, especially from childhood. Person will get other diseases that will lead to insulin, excessive sugar or insulin insufficiency. Some people feel get infection. Infection will go destroy that pancreas.
Not going to produce
the insulin well again. But commonly they occur for people way down they advance for age. And if you get people way acquire them from their parents too, if you get type 2. So
because it is inside family.
It is inside family. So if your mother get them, your father get them, and if both of them get, it go hard me get to. Except if you work on your weight and diet and all those things where they chop. So if you get type 2, or you do exercise. But if you don't have family, even if you don't have family history. And you still have all those risk factors, they do exercise, they add weight, they eat good food. When they say good food, nobody say you go gather all these sweet things, they not be good food. I mean balanced diet.
Okay, now we talk last time. Balanced diet.
So all those things can lead to type 2 diabetes.
Now be the difference now.
Yes.
So the difference now, according to doctor now, be say type 1 most times now because say something happen to the pancreas where they produce that insulin. Where they help us, they clean the sugar come out for inside our blood. So because that one not the work well from beginning, person go get type 1 diabetes. But type 2, if he dey inside gene, may he dey there or just sit down your own lifestyle will go drag and come out. Abi?
Yes. And those type 1 self, sometimes they will live all through their life with insulin. So some people call them, some people say it's a misnomer, but you see they say insulin dependent. Because that pancreas know they work again. So the person must
inject insulin for his body. Give the body insulin from outside.
Yes, because but the other one is not insulin dependent. That one you feel take drugs, you feel do dietary modification. A lot of people they are on diet. They don't take all those insulin as treatment. Yeah.
Say our children now, for example, I go really talk about not all of them, but I go start with children where you get intellectual disability now. Because as we talk for this program, the difference between intellectual disability and learning disability be say intellectual disability it come with different issues, different problems. And part of the problem now say the body not dey manage itself because the brain not develop well. Like when we talk about autism, like Down syndrome, we say the chromosome, one chromosome now you're divided into 2, which means a problem don't already there for inside the pikin body. So this kind of pikin now, we don't already get problem, we come with the gene, with the chromosome as they take born. this condition now not go already make person with, for example now, Down syndrome be already like create that opportunity for them to quick get this kind condition, diabetes. And doctor,
So,
what did I talk? We say as pikin now we get Down syndrome. So, for example, and we know say the reason why the person get Down syndrome now because in chromosome divide into two. One
yes,
of the chromosome,
yes.
and that one not be normal thing.
Yes.
Because that chromosome not supposed to divide. But because it divide now, the pikin it can't get this Down syndrome condition. So we may say in body now it don't change. So as this body don't change now, it go make am easy for this pikin to get Down syndrome. I mean,
very, very easy.
Go make am very, very,
Very,
easy.
very easy. Yeah, you know, Down syndrome has a lot of components. Even risk factor for diabetes.
Yes,
is
now
there,
one of them.
One of them. And as we would look at it later, you will see how this diabetes affects children, even those that don't have Down syndrome.
Oh yeah, but more talk now.
More talk now. Okay. Now, this diabetes is now common among pregnant women. But they don't know. They don't know.
No stand for them.
Now, in the early part of pregnancy, the development of a child starts quite early. And at the neural part,
that is the brain part now.
the brain part,
Okay.
that one starts very, very early, around 6 weeks to 9 weeks.
Really?
Those ones are already kicking. But you see, the problem is that if you have this diabetes, that sugar will increase what they call oxidative stress on the baby. So the development of that part, those neural development, brain development can be affected, especially if you are not aware that you have diabetes. That's why we say there are two groups of women that have diabetes in pregnancy: pre-gestational and gestational. Pre-gestational, she get them before she become pregnant.
And she know.
And she know. That one, they know they get problem well, especially if they are on drugs.
Because they don't manage am.
But the one where they always get problem is gestational.
The one where you don't know, you can't
You
go
know,
better and join
yes.
the belly.
Yes. And because they very common now, a lot of people, before you go see you just born your child, nothing happened to you, normal thing, then your child will get learning problem. Some people go there, waiting happen, normal pregnancy, normal labor, but that child get learning problem. It starts because probably when you were pregnant, your sugar was high.
Okay.
So that thing can affect the way where your child brain they develop.
See?
You go stagnate. You don't go grow like other children.
And
So
it go change.
you
Don't change the brain.
You don't
with
change the
that.
brain. How you go born your child? If they go class, you carry lesson teacher give am. The child know they perform well. You go say wetin they do. You go beat them. The child no fit perform. You no say that time when you get pregnancy, your sugar been dey high. You been get diabetes in pregnancy, and nobody detect. And that's why now I will always advise every woman, if you want to do antenatal, meet a specialist. So, because now even World Health Organization can say, Kai, because this thing can dey high among women, they drop the value for screening women with diabetes. A normal person, they say if your sugar reach above 7 millimoles per liter, you get diabetes. But for pregnancy, now 5.2. They have to bring it down
So that people go take am.
yeah, so that you will not come get you so that people will not be go get pikin where will
Yes,
come
they go
grow
reduce
and
the chances.
go reduce the chances. So people need to know this thing, and it's very, very bad. And they said that autism spectrum disorder
Yes.
is about 23 to 42% among patients that have women who had children children who were delivered because in women that have diabetes. You understand? And a lot of women don't know that. And in African setting, when you want to send woman say, Madam, please, you have to go and do sugar screening for diabetes. Say, it's not my position. To fear, it's not my position. My mother no get her. My father no get her. But there are a lot of women that don't have family history. The pregnancy changes. There are some hormones in the body where be say now them they produce them in excess so that it will help carry the pregnancy. But sometimes the production will be excess of normal. Instead of protecting the pregnancy, they will now cause your insulin resistance to be very, very high, and then you will develop diabetes in pregnancy. A lot. I mean a lot. When they say 30-something%, it's very, very high. So a lot of people that have autism, it may just be something as minute as sugar level, high sugar level during pregnancy. So for me as a person, every woman, initially they will say when the woman comes for antenatal and her weight is up to 90, then you now screen her for diabetes. Now, in the unit I was trained in our teaching hospital here, it's a woman that is the head of it. She said, screen everybody, and that's what WHO said. Screen every woman. It's better you overdo than not to do. So that, and we discovered that as we are doing it, we are picking a lot of women. Shall I give you a life testimony? My last child, this last delivery that my wife had, her sugar was high. She had diabetes in pregnancy.
Wow.
And when I was sending her I said, screen. She said, no, why? I go send me, she go screen for diabetes. When they did it, she was shocked. She was shocked. So we have to manage, and the child is okay. We are still watching. So, so that's a life testimony, and people will need to know about that diabetes is linked to autism spectrum disorder.
And autism spectrum disorder and intellectual disability.
Yes.
And plus the learning disability.
Plus the learning disability.
Yes.
We don't talk just now.
Yes. Yes.
I told now here now my people. I said today now Dr. Dana. Now he get today talk because myself I won't learn. Okay, when I send when you see the topic today, you say, madam, this one. He no be doctor. I said, don't worry, doctor they come.
Correct.
You know,
doctor where they call her doctor where you know woman matter. And if you know woman matter, you go know pikin matter.
As I was coming here, my car spoiled. I said, una no reach. As I was coming, hold up. I said, una no. I must say this topic is very important to me because I'm a life testimony. Yeah.
God bless you for making it, because you know, when they talk about diabetes, nobody they think of small pikin. And I should talk on just now. Because this is our country, this is our world today, for this our African continent. Everything now juju. If it not be juju, it go be devil. If it not be devil, it go be jinn. For us, we be Muslim. So if pikin get diabetes now, they go say, I know this one not be, it's not normal. It's normal low. And they tell you now so. It's normal because if mama fit get that diabetes for inside belly, if you give the pikin to now.
Yes.
Abi?
Yes. You know, if she has diabetes, yeah, very, very important. Let me even go more specific on how it causes brain damage.
Yes, but that brain damage never be the matter.
Every child in pregnancy, the brain of every child has high level of insulin receptors.
When they collect insulin,
they just have the receptors like door for insulin. That's so. Now a woman who now has diabetes, the thing go come dey high.
It go too plenty.
So because that sugar come dey high, you know the pancreas go overproduce insulin to control those sugar. Those insulin go just dey waka for body, and because it dey waka for the body of the baby, it will cause a lot of things. It will affect the baby's abdomen to be big. It will affect the baby's liver to swollen up. It will go and stimulate those receptors in the brain that baby has. So once that insulin stimulates those receptors, it will now start affecting the development of that baby. That is if the baby escape normal those insults around 6 to 9 weeks. I'm talking about a big baby now that is about to deliver, maybe like 7 or 6 months.
Now you talk so.
Yes. So those receptors now, those insulin go come affect that those
brain development.
So you see, say that child you come born am, you go get learning disability, you know, exhibiting some intellectual behavior issues. You will now be wondering, hey, you sure say no be that woman who been quiet that they go do babalawo for me. No, say now one simple thing: diabetes in pregnancy.
Now, doctor, thank you very well. Because you get where this thing they touch. Recently, we don't notice serious spike in the number of children where they come down with different forms of special needs.
Yes.
Yeah.
Like the spike high where. In short, it go hard make you meet teacher or person where they teach class now. Ask them, say inside your class, you get picking where they struggle, where like 90% or all of them no go tell you say, you get one pikin, you get one or two children inside my class where they struggle. Yes. And recently, you can't get the prevalence now mainly around this ADHD.
Yes, ADHD. Attention deficit.
So many children nowadays, they don't even fit in one place to reach 5 minutes. Yes. So teachers don't stress, tire. In short, some parents say when they don't tire for their pikin for house, they go carry and go find school. After school, they go pay for after school lesson.
Make it just
after that
them,
one,
make
even weekend, they go find who will come help them. You know, they go find even later, they go carry the pikin, go drop it. Because they don't feel manage the activity level.
Very correct.
Last weekend, I do screening for one family with young children. Within the 1 hour when I do screening for these children inside my office, then don't come on almost everything where they want.
Wow.
All the charts, all the manipulatives and resources where they want, they pull out. And they see something for your hand, you like say they like it, they come, you don't reach 30 seconds, they don't move to another thing. Move to another thing, move to another thing. And these same children now, on top of the hyperactivity, their speech don't follow the lead.
Very correct.
So it be like this thing when they talk. You get possibility say if you follow cross reach areas like ADHD now and even speech delay.
Very, very correct. It will reach. You know, anything during pregnancy that affects the nervous system, whether central for the brain or peripheral for the spinal cord and for the part of the body, will affect every part of the child's development. Now, I think this is a call. People should start comparing women who had elevated blood sugar, follow up their children to like, let's say, just say 5 years after delivery, and see those women that had elevated blood sugar or diabetes in pregnancy, what happens to their children in school. We'll now use you now to screen them for us and see, do they have most of these conditions, so that the alarm will now be raised, so that everybody will now be on deck to work. This thing is actually in pregnancy, so that you will not be blaming one mama for a village, you will not be blaming your neighbor, you will not be blaming your sister, or you don't be change school. You go say, it's not this, it's the teacher. The teacher doesn't know how to teach. You go carry your child, go another one, he still do the same thing. You know, so I think it's actually a shame. When I saw those figures, even me myself, I was shocked. And you know, diabetes is as toxic as anything, because even the pregnancy itself, it causes wastage of pregnancy in the early part of your pregnancy. If that pregnancy escapes wastages, it will affect development of that pregnancy. If that development escape, the child brain will be followed again by those high insulin in the receptors. And before you know, the child will have some developmental problem. So the call is from every woman or every doctor, not every gynecologist, should go back and ensure that every woman is screened for diabetes. This small thing that you are doing will be the saving grace for that child, because the woman will just leave you after delivery. You don't know what happens to her child. She'll be battling. You don't know that it's just that thing that you refuse to do. As a principle, all women that come for antenatal diabetes, whether you have the risk factor or not, I screen you. But those that have the risk factor, you can't escape my screening. And it's just a day screening. You just go, they'll give you glucose, you take, and they'll measure your sugar level. They check it after 1 hour, check it after 2 hours, check it after 3 hours. That's all. And if any of them is high, you have diabetes. It is better for you to over-treat than to under-treat or not to do at all. That's what I feel about this. So,
thank you so much, doctor. So, doctor, don't tell us now. This one now, even before the pikin we even born now. So, which means now, say, I want to ask this question. Diabetes, because as it is so now, this diabetic situation, now, what if it cause anything, according to what you do, doctor? Which means, say, this diabetic if it cause asphyxiation, we say the pikin go shit for inside water.
Yes. Yes. Shit inside for yes during pregnancy. In fact, if a woman has diabetes in pregnancy, because those complications occur in the last 4 weeks of her pregnancy, most most doctors, gynecologists will not allow her to pass 40 weeks.
They don't
Now,
operate and fast.
now they don't bring it. They have brought it down to 39 weeks. At 39 weeks, once you reach that stage, deliver that woman by whichever means is easier for you. The reason being that, just as you said, those shitting in
the water.
Yes, meconium. If they shit, they will now swallow it. That one again will now go to the brain and cause damages. So diabetes alone, a woman can just wake up. It's as bad as a woman can just wake up after that 39 weeks. She just wake up and discover that baby is not kicking again. Before she comes to the hospital, that baby don't die.
At that stage.
So that's why they said, because the death of babies at that time and the damages is high from that 39 weeks, they said deliver all women at that 39 weeks.
Whether not CS or
not. In fact, they will have said you should deliver earlier, since they say that the problem starts 4 weeks in the last 4 weeks of pregnancy. But the problem is that the diabetes slows the baby's lung development again.
The development of the lungs.
That thing about it slows the baby's lung development. If not, 36 weeks will have been the appropriate age to deliver. But the fear is that if you now go and deliver at 36 weeks and the lungs are not matured now, it means that baby now will come out, no fit breathe well, it will fit die. Then they say, okay, let's push it to like 39 weeks, we deliver. So it's a very, very, very serious issue.
Okay.
And for the woman, if you have diabetes, my advice for you, make sure your sugar is well controlled before you go into pregnancy, because you may just give an insult to your child. What I mean insult, as in damage to the nerves, the brain, just because you refuse to control your sugar. You just went ahead and take pregnancy. That child will manage to survive and you deliver. The child will come out, be having some challenges in life. Reduce a lot of things for you. And then when you now become pregnant, you still have to see a specialist. I see a lot of women, because of cheap things, you go to a small hospital just because you think it's cheap. But cheap things are expensive.
At the end of the day, expensive on the long run.
On the long run, yes. So go to where, just say, I want to see a gynecologist. I have diabetes, I'm pregnant, I want him to manage me. With that, you have a lot. There are a lot of women who've managed, I think that woman has a child that has developmental issues. But she didn't think it was a diabetes. The only thing that brought her was that she has been having babies that died at delivery. So, and I told her that we don't start talking about all her child. Are they doing well? She now told me that one of the child is not coping in school. This and that. She feels it's because maybe the labor. I said, but you delivered after a short period. She said yes. Well, I said it may be this diabetes. She was shocked. So I told her that this pregnancy will have to control your sugar very well. I invited an endocrinologist. He came. He managed her sugar. I think all through her sugar was below 6 millimole. And she did well. We are still following up the baby and see the difference.
You're monitoring the difference?
Yes.
As your own research?
Yeah.
God bless you, Dr. Dana, for your work. God bless you. So, we don't talk all of this talk of the toxins now. Mama, now us gain well for this one. Those where they plan to become mama, not be just to say I won't carry belly. Let it is there inside. We will go sit down. Take care of yourself. Then take care of yourself throughout the entire pregnancy. And the fathers of the pikin too, una work join.
Even the papa, they don't learn.
Yes, now papa too.
Never learn.
I beg, learn learn, because now 2 of una 9 days this join. If the 3 of una join the pikin, that na if na one, if we go be twins or triplets, na don plenty for inside. So Dr. Dana, the next question when I can't get for you now, be so okay. After all of this, if the pikin can still get diabetes now, what will be the advice where you go give parents on how to manage their children when get diabetes so that it not go affect both their learning and other aspects of their lives?
You know, women who have diabetes have high chances of giving birth to children who develop diabetes, and the children may develop it at an earlier age. One thing that a lot of parents don't know, that you can control your children's diet when they are small. It's not always, people like chubby babies, but it's not always, is not always good like that. Doesn't mean that it's bad, but it's not always good like that. My child was telling, my first child is in secondary school, he was telling me, Daddy, why is it that all this food I eat, I'm still looking slim? I don't add weight. I said, do you want to add weight? Excessive weight is not good for you. I said, sure, you ride bicycle. He said, that's why you're not adding weight, and exercise is good for your body. So parents should start at an early age. Start teaching them on what to eat, when to eat, and how to eat. So if you tell them all these three things, when, how, and what, they grow up and learn that it's not just eating every time. Excessive taking of ice cream, for instance, you think you are doing good for them. Sometimes it's not good. You want to buy meat pie, shawarma, pizza, all those things. I'm not downgrading all those people that sell them, but I'm saying that excessive intake of those things is not too good like that. So parents should work on diet. Tell the child that, no, you've taken this, don't take it again. You took cake just now. You want to take cake. You can't be full with cake. Eat normal roughage. Eat normal pounded yam. Eat normal aku. Those ones are good. You eat it with egusi soup. You eat it with okra soup. Those ones are very healthy. But when you now say you want to buy those junks, those milk, you will see your child getting chubby, and you know that you have diabetes. That child may have that diabetes at an early age. If you see any person who die of diabetes, most of the times he had it at an early age. Diabetes that occur in a very later age has better outcome, especially if the person is committed to control of his sugar. But when you start it at a very young age,
you don't weaken many things.
A lot of things. The diabetes affect your eyes. You have problem with vision. Affects your brain. You may even have memory issues as an adult. Yes, it affects your kidneys. It affects your liver. It affects even your legs. It affects the blood flow to your limbs. That's why you see them having amputation.
That's why they cut their legs.
The nerves in adults, it affects the nerves so that your nerves will now start having issues. You go touch something we're supposed to pain you, you no go know. And that's you go someone say, I'm seeing wound in my leg, but how come I didn't notice? I don't know when I wound myself. So you see that you yourself, you'll be having
lose sensation, you will lose feelings for that place.
Yes, when you are young, you like wearing shoes. You can see mommy now, she's just wearing simple open shoes. But for us young, we would like to wear shoes. So imagine you have diabetes at that age. It will affect even the quality of your life. You will feel you are restricted. Why can't I wear shoe like my counterparts? Why is it that every day me I do wear I'm always in palms? Why is it this and that? So you have a lot of imagine at an early age you don't have the opportunity to eat big meat, fish. You don't have opportunity. You are already controlling your diet. You can't take sugar like your friends. If you chop bread, you have to select bread at that early age. If God can help you now, you can't get good work. How you go take the maintain yourself for that age? So most of them they die before.
They die early.
Die early
because there is no way they can maintain a healthy lifestyle.
You can't.
And the mental impact. Their emotional and their psychological impact will be very bad.
Very bad. Some of them will commit suicide. How can
because
I
of depression and anxiety.
So it's like a very, very, very. It's a spectrum of problems.
So if it be like this for regular people, it go worse for people who get condition like autism or Down syndrome.
Yes,
or cerebral palsy. It go hard.
You still have those issues. You are still managing.
Because they are diabetes
join them. Hey, so I used to tell people that gone are the days that we talk about. We talk about marriages for sickle cell alone.
We
have to start other things like diabetes. I have my father has diabetes. Your father has diabetes. We should consider. So that we not bring our children that During pregnancy, you now have type 1. During pregnancy, you now have, these are some of the things that we should consider.
Okay, we will consider diabetes.
I'm telling you, those things are very, and that's the only way of killing diabetes.
That's how you can kill diabetes.
Yes.
Over time, over generation, you go die.
You go die because you are refusing to marry each other. So the spread of those genes are being taken care of.
Then
So you now have, so the impact of the two genes will be broken along the line.
Okay.
So those are some of the things that I think we should start considering, and that will help a lot of people. Yeah. Sorry for the men. I have to be talking about women.
No, the men they get too. No offense, because the thing when they affect this woman, it will affect the man eventually. Now.
Yes.
No,
Yes.
I just imagine, say, as man, breadwinner, and anything will happen to your pikin or to your wife.
Now you have that don't happen to you now.
Hospital visits, to pay for consultation, buy medication.
Oh.
In short, even if na bread you like to chop, for the fact say your wife or your pikin no dey chop
You
bread,
go come out them now.
bread no dey that house again. Make they no go mistakenly carry the thing
Yeah.
put you for problem again.
Doctor, make I ask this question. They send people don't send question come.
Okay.
Okay, the first question be say how fluctuation for blood glucose now will be the diabetes what they talk so how they affect executive functioning and working memory.
Very
It
good.
plenty of executive functioning, working memory, attention. Oh, yeah.
Yes, fluctuating sugar is more dangerous
Okay now.
than persistently high or low sugar.
Really?
Because you know the cause. You have sugar today, millimoles. Tomorrow you have 5 millimoles. Next tomorrow you have 15. Those fluctuations affect your organs more.
Really?
Yes. It's like you open your eyes, you see masquerade. You close your eyes, you don't see them. You open your eyes, you see masquerade. You go just confused. So those are some of the things that you will be scared. You say, okay, should I open? Should I close? You understand? So that's what happens to the body. And let me tell you, in pregnancy, what kills baby is fluctuation in sugar. If you have sugar of 10 tomorrow, 5 today, 10 tomorrow, you will just have one sugar and you just cut off the baby's life. So we are always concerned about fluctuation in blood sugar level. It's very, very important. And it affects the stability of your brain. So memory loss is actually very, very, very important in terms of fluctuation. You see people you see someone you're just talking to him now, he goes absent. You understand? Just blank. Maybe his sugar level has changed.
Has fluctuated.
Maybe it was normal, now it's low. You understand? But when you have a persistently stable surgery, your organs will recover better. They will react to some of the changes. They will be able to recover from the effect of the sugar. But when it comes today you do this, today you do that, your organs will just be in disarray. And that will affect every part of your body.
So both the executive functioning, because executive functioning, this question be say, what will be the work of executive functioning?
Now, executive functioning be that part of your brain where they help you solve problem, reason logically. Executive functioning, maybe as you don't hear, I like the way this camera be. I won't go turn them, but because I know if I turn this camera, we know people where they watch us for the back end no go fit see what we do. You go fit help me control my impulses.
Yes.
Make I put myself together.
Yes.
You understand? Make I no go cause any problem.
Yeah.
So even something where they interest me, I feel actually reason. No say I like this thing, but if I do it go cause wahala. So make I hold myself. Executive functioning now waiting go even help pikin say okay maybe you get problem with your peers. You go feel know how to take negotiate. Say oh yeah now maybe I need this ball. You know one give me. Make we bargain if okay you play and small. When you play and finish, give me make me have Now the work of executive functioning and you need them to take learning. You need them to take leave with people. You need them for emotional intelligence.
Yes. Yes.
So if now only book you sabi you no get what do they call it, executive function, you will struggle well even inside that school when you did. Yeah.
So an attention too.
Yeah.
Yes, they will follow the right path.
So this fluctuation of this blood now it go affect
very well
all of this ability
very
to make this decision,
being organized, and take critical decisions. Yes.
Even no road.
Now that I explain executive function, now that's what fluctuation in sugar level does.
Wow. Okay. The second question now. If man will get diabetes, impregnate woman will not get diabetes, will all this health challenge affect the baby?
No.
Okay.
Yes, that's one thing. The link is mostly from the woman.
Okay.
But if, well, the child may have part of those risk factors, but it may not be there.
Okay.
But for the fact that impregnated a woman, he has diabetes, doesn't mean that the child is automatically going to have diabetes.
No.
But there is still a risk.
There's still now the risk now there.
Okay.
Not be the actual.
Actual.
Okay.
The woman may not develop diabetes, and if she doesn't, it doesn't mean that it's going to affect the child. But the child himself, later in life, because he has acquired that gene from his father,
can now have
Can
diabetes.
now have-
Can now be more open
to diabetes.
to getting
Yes,
diabetes.
but during pregnancy, not really, except if the woman has. Yes,
So which means that diabetes where the man get now risk, but the diabetes where the woman get now sure.
yes, yes,
No
yes.
control.
If no
If you
control.
not control her now sure. Okay. But the thing we said that if papa own, it dey inside his body in gene form.
In gene, yes.
So that even if mama not get, if he still get,
Gets correct.
if he not live healthy lifestyle.
Lifestyle, very correct.
He taught everybody. Nobody fit don cross it. So say this one not near me.
Yeah. So the solution here we say, if you not get diabetes before, no get.
Try me.
Try make
Maybe
you
no
get.
get.
Man now they talk so.
Yes.
Try make you no get. So that because the woman now, if because pregnancy itself fit cause the diabetes.
Yes, on its own.
On
Even
its
if you
own.
don't have risk
Even if the
factor.
woman not get her before pregnancy fit bring
Yes.
down.
Yeah. And the good thing about the diabetes in pregnancy is that it resolves after pregnancy.
Yeah.
But it resolve, but it don't affect pikin now.
It don't affect pikin. That's one
What
thing.
you be the result? Carry on now.
But with a caveat, it resolves after pregnancy. But those women who have diabetes during pregnancy are likely to have it later in life. So it's even better for you to know that, oh, this is why I don't get them for pregnancy now. If you come later, make us start today, check my weight, check my diet, go do exercise, so that even if you go come, make you come around 60, so that I feel live for another 30.
You know they near.
But the pikin don't they affected now.
Yes, but that pregnancy, you go feel affect the pikin.
Okay.
You don't affect it. So it's better make you control the sugar.
Okay. Today topic, huh? It's wrong. It's wrong. Eh? So okay. Doctor, this question says, so how do you manage it? Both as a woman with the diabetes and the pikin will get diabetes too.
Okay. For the woman we get diabetes in pregnancy, that's the woman where they get pregnant with that.
Yes.
It's simple. There are normally, when you have diabetes in pregnancy, they are not in a rush to give you treatment like drugs or insulin. But if it is very high, mostly now insulin will they use for pregnancy, not drugs. Most of those drugs, they are not safe in pregnancy. But like some of them are becoming, studies are showing that some of them can be used in pregnancy. So you go and meet your diabetic doctor, then he will now refer you to a dietitian. Yes, like our own, it was just diet, and it has been it was controlled throughout. After pregnancy, it was not there again. So what you should do is go and meet them. They will refer you to a dietitian. She will now give you like how you control your diet, what you should eat in the morning, afternoon, evening. Then, of course, when you are pregnant, they will not say you should go and do exercise. So mostly it's just dietary control. So that now emphasizes the fact that during pregnancy you need to work on your diet, whether you have diabetes or not. You know, this woman will say, they say if I don't eat this, I don't eat this, my child no go grow well. See, let me tell you, what your child needs, the changes in pregnancy alone will bring it for your body. All you need is balanced diet. Fruits, eat vegetable, eat protein, eat small carbohydrate. You know, if you do that during pregnancy, you have all your proteins, and then take your antenatal supplements. Yes, you know. So once you take those ones during pregnancy, you shouldn't have an issue. You shouldn't be eating. You see, and some people believe that if you are hungry and you don't eat, you will die. And I lie. Just it's normal. It's normal.
Doctor, I get question. You know, say you get some kind, you get women. In short, you get common place around this our society. We to say inside pregnancy, some very strong cravings today. We be say if you no chop that thing,
yes.
we dey crave for serious problem if you dey that house.
Yeah, no. Cravings there is some of the changes of pregnancy, but some people exaggerate it. They go just wake up say, "Na pepper soup I want take." The man go they go up and down, they look for pepper soup, and not knowing that pepper soup may not be so healthy for you during pregnancy. Some will say, "My craving and shawarma, every day shawarma or chocolate." But you should also know that those things, they are not too good
For the baby.
for the baby and you.
And you.
So it's cravings are there.
You have to, even with your cravings, you must still make good choices.
Exactly. And control how you
must
crave.
still make intentional good choices.
Yeah.
Because at the end of the day,
Those ones.
now you carry
There's a woman that craves for. What's this fruit that is sour? It has back.
lemon.
It's not lemon. It has yellow back. In Hausa, I know they call it agwaligua. Agwaligua in Hausa. Yeah, yes, like ogbono inside.
Yeah.
There's a woman that actually craves for that. I buy it a lot if she asks for it, because the truth is that
It's healthy.
it's very healthy, has good vitamins and all that, and it's sour. So that is a very good craving.
Now what you
Not-
crave for that? Now belle ask for belle.
Some they even crave.
Every woman belle no go ask
Then
for
they crave, they give number. I am craving for 2 pots of fish.
Oh my God! If I say you don't see plenty, doctor say they crave, and they give number. You want to pot of fish? And when the man walk put now, see the walk, when you see the walk put. My
Okay.
people, now do well. Oh, we don't talk plenty today. I mean, what is in my head? Where would they talk about this topic? What we call talk today? Pass on. You pass on. As I talk today, I said this program now for Dr. Danat to come teach us. And me, I learn. I learn because this diabetes not be joke. Not be joke at any age. Imagine make our pikin wey get autism or get Down syndrome, get ADHD, get dyslexia, e can't still add diabetes join. It will affect the eye. And diabetes they cause low blood pressure, abi. They cause low sugar, hypoglycemia, abi.
Yes, if you are not well controlled, yes.
Which means the sugar go down. That one fit cause plenty things.
You know, low sugar is more dangerous than high.
Than high sugar.
If you feel die, just low sugar, you just collapse and die.
And
But high sugar, it will give you symptoms. But low sugar has symptoms, so but if you are not mindful of them, it takes your life.
Okay, you know, see this thing where you talk. It happened for our house. That time, now so my mama, anything that concerns sugar, she don't want near them. In short, she go drink this herb, drink this one, drink this one, drink this one. One day, now she just go down. Now we rush her go hospital.
Say sugar.
They say that say sugar don't finish.
you don't overdrink.
Now she come back with packet of sugar.
Low sugar is more dangerous. So.
They tell us, say we don't off like that now, so you don't go.
My mother,
She begin to take sugar.
you run for sugar, so they call the top sugar by force. I mean, I don't feel laugh, Mr. Sam. Doctor, one of our listeners get question. They say Boniface, may fit, they be like say they burn, they hot.
Yes.
So that is one a sign of diabetes.
Yes.
I say yes.
Correct. We call it diabetic neuropathy. Neuropathy, what happens is that the diabetes go cause your veins make them they stiff. So as they had the pump blood, the blood no fit pass.
Yeah.
So that place where no get that blood go complain. That complain, I mean that burning pain that you.
Really?
Yes.
Not be small sort you.
In fact, some people that first symptoms of diabetes is that burning sensation. You just feel that having one burning, but it's not always. But it's a good symptom.
This question now from my mama. I go do ojoro. She say many food for this our country na carbohydrate.
Yes.
So how we go fit take manage diet? As if it's not also carbohydrate, that carbohydrate plenty pass. How we take manage diet to take avoid diabetes and this issue of managed diet and carbohydrate, it dey affect poor people as well. So
yes, yes, I agree to it. You know, for you to make a good choice of your diet, it actually requires some financial muscle.
Wow.
Yeah. You know,
so poor now, diabetes that go kill am.
I'm telling you because but funny enough, there's something we are picking from. I don't know where we're getting it from. If you have dry maize, you want to grind it to cook tuwo. You know, people go and remove the chaff so that it will be white. That chaff is the roughage in that maize
that will prevent you from
having diabetes. So I've told my family, don't go and remove that, grind it like that. It's not the color, it's the nutrient. And that's why people with the rear pig, they go carry that shaft where you remove, go give the pig. You see the pig big, well. And that's what you were supposed to eat it.
You not eat it, you carry
remove it. So our local diets are not, they are carbohydrate, but they have a lot of roughages. Yes. They have fibers. Like our yam has fibers. Yes, those fibers are good. Our sweet potato and everything. It's just that you should eat them in moderation. If I want to eat pounded, I always insist that it must be with vegetable soup.
Vegetable soup.
Yes, or egusi soup. But the egusi, the oil that you use should also be small. And then the egusi should be moderate, but a lot of vegetable there. Okay. So I mean, if you eat it with fish, dry fish, very beautiful. Our diet don't have problem. Just that we like eating, I don't want to call names, all those noodles. You know, those noodles, some of them have high level of carbohydrate. You know, alabo has high level of carbohydrate. People don't know.
It should be
Elubo. Really? Amala, you know, not amala is the one they use the back of yam now.
No, they also use the yam, but they soak it.
Oh, they soak it. Okay, those that soak, sometimes they remove, they soak, you remove some of the fibers, some of the carbohydrates there. But the normal one that they don't remove it, they will just peel the cassava, you know, go and grind it and sieve it. That one has high level of carbohydrate.
You mean the cassava? Yeah. But cassava is acidic now.
They sieve it. Yeah. They sieve, they grind it, and then they sieve the fiber out. Yes. So it will be very, very, very smooth.
Yeah, but not be starch.
No. Starch too has high level of carbohydrate.
Now they talk about starch is very starchy.
It's very starchy. Now carbohydrate food there.
If you eat starch today,
you know people the way they soak gari, then they say na poverty. Gari na good, Gari has a lot of fibers, so it's good for you.
But the kind gari, gari different.
Because
some people they say gari not today. No, it's true. They go farm. They go harvest cassava today. They go peel out today. They go grind out today. They go fry out today. That one a death sentence.
I'm telling you. So a lot of
and it's even over for one day now.
Exactly. You soak it. When you soak it, you remove some of the starch in it, and then this. But you can just take a moderate quantity.
Okay, so this amala not good.
Make I not condemn some people diet.
No, not good by itself, or not the process of making.
The amala, you know, they use the back of yam. It has fibers.
The back of yam
is good. Okay. Very good.
They use both the back and the inside now, Abi?
Yeah. Those that use only the inside.
Yes. Okay. It's not
the fibers are high.
The
carbohydrates high. Yeah.
What about the plantain? Because not three types of amala there.
Okay.
Lafu na cassava amala.
Okay.
What they use cassava for?
Okay.
Then plantain day.
Well, I don't think plantain has a lot of carbohydrates like that. Yeah. So that one may be good.
Plantain passed the test. What about cassava? Because we know say cassava is gluten-free food.
If you know soak you just grind them, remove, sieve them again. That one has a lot of carbohydrate there.
What about akpu? Is akpu not good with that now?
Akpu has a lot of fiber. Yes.
So how many days you take soak and we go take get fiber?
You know how they
No,
You don't know. You know how they do.
Stages.
You know how you get stages. That's staging. That's the, you soak the cassava.
Yes.
For a long time. The thing go come soft.
I mean, go come to smell.
Bismillah. Before you now cook it, remove the water, cook it. Okay.
Now the one with the smell when I get they healthy pass.
I get healthy pass.
Okay now. Even people don't win for this one. Okay. Wait to. That one they soak now. What about if you because like a kamuna, for example, if you want soak until you change the water, it matter?
Yeah, it good too.
It good too.
But the kamu has high carbohydrate.
Really?
Yes.
Even though you ferment, huh?
You ferment, but you still there small. It dey. Akamu get high carbohydrate.
It's not they which means it's not they healthy.
It's not. No. I'm not saying that you cannot take it, but you can still take it. You know what they surprise me? Someone go carry akamu, come put milk inside, come put sugar. That cup, that cup will not be smart, you know. Then we should talk about diet. Meat. It's a very serious thing. You have to work on meat.
So which is better, fish?
Fish. If you want to eat meat, white meat. Like normal chicken. Rabbits. You know. And
it's better.
Yes.
Okay. So this person they ask how you go to manage burning sensations. Be like saying get burning sensations.
Okay. Yes, that burning sensation have stages. First and foremost, you go ask. If not for your leg, you get problem. But sometimes, if not for your body, it may just be maybe you are premenopausal and you are feeling those symptoms.
So, man, they ask.
Man. Okay, man. So those burning sensation, there are drugs that they prescribe that will go and open some of those vessels. Okay. And then there is a scan, they call it Doppler scan. Okay. That scan they go do and make them see where the thing block. Okay. They can give you drugs, like drugs that will go break those clots, cover those vessels, so you now manage. So it's not you alone, but one thing you can do for sure that will improve it is exercise.
Because you go push the
vein, walk, try like walking. Walk. When you walk, do your heart to pump better, and then those vessels, some of them will open. And once you walk, you burn fat. So those fats that are clogging the blood vessel will now open. Then you now have proper blood flow to resolve. But there are actually drugs that you can take.
While you are still doing the exercise.
Exactly.
Push the blood and push the blood.
Exactly. You know, Africans, we like drugs. So they like drugs like food. But there are a lot of things that you don't need medication for.
You just need to change your lifestyle.
Yes.
Sleep. Lack of sleep results to spike of blood and all of those things.
Oh my goodness. Who asked that question?
Now me ask.
Oh, okay. Sleep disorders are risk factors for diabetes. Damn. Poor sleep. You know, some women will say, I like sleep. I can sleep for 12 hours. You are sleeping and you are adding sugar to your body. Once you sleep, your cortisol level will be high. Once you sleep or you oversleep, cortisol production is distorted. And high level of cortisol is implicated in diabetes. So normal sleep, you can Google normal sleep hours for my age. Put your age. You will see the normal sleep hours. Maintain that. A lot of people, you see, somebody will just wake me or call me around 5 a.m. And I remember we spoke with that person around 11. So that technically that person slept for only 4 hours. A lot of people are not sleeping. Is the cause. In fact, sleep, if you ask me, I will tell you that the cause of diabetes, hypertension now, all over the world is poor sleep. People don't sleep. Try and sleep. If you're an adult, try and sleep minimum 6 hours. Okay. But not too much again. Excessive sleep, another problem. Somebody is searching. Somebody is searching for the sleep hours. So you can search sleep hours for 25-year-old. You see it.
You know this thing now. We don't come celebrate the fact say, I know they sleep for night. How you as adult go they sleep 5 hours. And when your mates they make money, they hustle. And they don't they feed plenty people with that kind of mindset. So if we even sleep for nights, person go the reason say when your mates they hustle, they grind, they make money, they sleep. And this thing where you don't talk now, if it be part of the reasons where young people they get conditions where people suppose they get for 60 years 70s.
I'm telling you, hustling. Hustling. You see this phone and laptop, they can keep you awake for 24 hours. You won't know. And those excursions, it causes release of those oxidative stress radicals. So free radicals. So they will come and cause damages in your blood vessels and all that, and then you start having high blood pressure. A lot of young youths hustling, they will collapse.
And they go die.
I think this year was it this year or last year that we lost 2 young people. And if you ask the history, they will tell you they are very hardworking. Very hardworking. So and you are hardworking, but you are not checking your blood pressure, you are not checking diabetes, you are not sleeping. So sleep is a very serious risk factor for diabetes.
Okay, now we go house now. We're not go talk. The same way we go more they sleep. So part of sleep is say we go close now. part of sleep we say part of preparation for sleep we say we go close. We'll go yeah, we'll go sleep. I'm a doctor.
Yes, ma'am.
Make una too they prepare for sleep too. The same way they sleep minimum of 6 hours.
Yes.
And now from now we go start to plan the 6 hours. My people, that one. My media man said that one hard though. We go find out. We go find this because this money now we dey find money. Not even they find us. It's true now. If you want to chop the money where you dey find, you go dey healthy now.
Yes. Yes.
May not be saying you can't get the money finished. You not fit buy your health.
Yes.
Keep it the point.
Diet.
Keep it the
Swallow
point.
medicine.
Swallow medicine. Keep it the point. So my people. Today's topic we start late, but not very so. But the topic it makes sense. Over makes sense. Una do well, so una stay with us so till this time. I mean, we chop minutes, join minutes. So, but una do well. Dr. Dana, thank you so much. God bless you.
Thank you.
I beg greet our people. Doctor.
Now good day. Thank you for listening. I hope we have helped you solve some of your problems.
Yeah.
Thank you.
Ogasam.
Better people. I know the joy we draw from my belly plus the learning when I don't carry.
I'm telling you for free.
I beg anything when you don't learn today, make you apply it for your life.
Yes, very
and
important.
if you get person where they do anyhow, I beg just advice and join. Yeah, wanna do well,
Antenatal for pregnant women.
Yes,
very important.
Say, doctor say antenatal for pregnant women very important. Any woman wey see say e body e not be like as e think say e be, go hospital, go see gynecologist. Because women body dey change, no matter of age, anything fit happen. Go hospital so that you go fit take care of your body, not just because you want born, but because you want dey healthy first. Una do well, my people. Until next week, that may be Mrs. Modupe Afizogun. Bye bye.